virtually since last March. It's almost a year now. But as the vaccinations were becoming available, we all saw that ray of light at the end of the tunnel. We, along with the rest of the nation, were put on notice to get ready. Vaccines are coming. But since late December, when the vaccinations were released, Philadelphia has fumbled a bit along the way in working to get vaccinations out to our residents in an equitable, responsible, and patient-friendly manner. I want to be very clear. The mayor and the administration have put out a vaccination distribution plan and have been executing it to the best of their abilities. It's important that we make very clear to the public there is a plan in place. It includes normal distribution channels, such as what was announced yesterday for community site locations. But this isn't what we're talking about today. This is a mass vaccination plan we're talking about today that replicates the efforts being made across the United States in other cities. We're seeing stadiums in New York, Boston, LA, Houston, and several other cities, indoor and outdoor. Public health departments are working to vaccinate thousands of residents daily. Levi Stadium in New York announced a goal of 5,000 doses per day. We've heard from the President of the United States, President Joe Biden, that he's supportive of this effort. We've heard from the NFL Commissioner, Roger Goodell, that all stadiums are available. And we've heard from the Philadelphia Eagles, their leadership. They're standing on standby, waiting for us to call them into action. They want to help. And by the way, everyone we have spoken to, everyone said, we want to help. What can we do to help? Operation Philly Special is the playbook that brings all of the city's assets to bear to fight a deadly virus by working together and building a mass vaccination plan before supply chains increase. Dr. Farley noted yesterday that he expects Johnson & Johnson, the vaccines, to be here in just about over 2 weeks. So today we call on the mayor and the Department of Public Health to develop a comprehensive plan now, so that when vaccines increase to Philadelphia, we're ready. We call on you to dedicate a majority of those doses to mass vaccination sites like Lincoln Financial Field and reserve the remaining amount for targeted communities, locations like those that were announced yesterday. This plan is in addition to what we're doing. This plan is when we currently have 20 to 24,000 vaccines. At some point we'll get up to 50,000. These plans will get implemented and we will be ready. We call on our Office of Innovation and Technology to build and manage an online tool with the health department, like other cities have done, that allows every Philadelphian to go to the online site to register for their vaccination and get an appointment to be placed on a waiting list in priority order. We also need to coordinate the ability for people who don't have access to computers to a call-in center. The city needs to control this process. We saw recently what has happened when the city did not control the process. We ask our health systems and any non-affiliated medical provider authorized to administer vaccinations to work with us and the city to staff these sites. We call upon Governor Wolf to mobilize the National Guard, if need be, to help us quickly make these sites operational and provide the staff power to execute on-site intake and discharge of patients. I know Senator Sharif Street was going to be here today, but he's held up in a hearing, and he is working on this for us. These sites will use best practices informed by our health systems in cities like New York, Boston, LA, as well as local nonprofits like the Black Doctors COVID-19 Consortium, who've been working to ensure we leave no one behind. They have focused on equity and access this entire time. I actually have spoken to Dr. Stanford from the Black Doctors Consortium several times, and I spoke to her this morning. And by the way, she is doing an amazing job, a great job, one of the best I've seen. And I've asked her on several occasions to manage this process at the link to make sure that equity and access for all Philadelphians occurs. And she has said to me, if the administration wants her to do this job, she'll be happy to run it. And she is, by the way, she is doing an amazing job. She understands, and everyone here understands, that it's not just about creating capacity to get these vaccines into people's arms. It's also about how we prioritize and control the access points so that we avoid issues of inequity. We have to be sure we're following the CDC guidelines by thinking through how we schedule these appointments and attack this from a needs-based perspective. For those who are unable to schedule an appointment or to get one of these sites, we call on the Mayor and the Department of Public Health to dedicate the remaining doses to targeted communities through pop-up clinics, local supermarkets and pharmacies, and mobile vaccine vans to be coordinated by the department and in cooperation with City Council and our state delegation. Mayor Kenny has a plan for right now, but what we need going forward in the future is a mass vaccination plan that enables us to vaccinate upwards of 5,000 people per day at one location, one that's efficient and effective. When the call comes in, and it will come in, and the supplies are here, we can't be on our heels trying to figure this out, scrambling around to find partners. We need a plan now. The plan has to be vetted, which we're doing, and coordinated details laid out for everyone to see. So our goal today is to present this plan to the administration, bring everyone to the table, including City Council and all of our elected leaders, to vet a plan that works for where we'll be in the near future. So this, of course, has come together with the support of everyone you see here today. And first, I'd like to recognize and introduce my very good friend, someone who spent a career of bringing people together to solve problems, former Congressman Bob Brady.
Thank you, Alan. Thank you. Thank you, Alan. Let me first tell you how we got here. About 2-3 weeks ago, I was watching TV, and I saw in Jersey there were people at a mass vaccine site, and they were lined up. There had two lines. One line that didn't have an appointment with about 100 people, and the other line was about a mile long. And they were lined up in the rain, pouring rain. I saw an elderly lady sitting on a bag of rock salt, all bundled up, waiting to get a vaccine to make her healthy and maybe getting sick while she's waiting to get it. So what I did, I reached out to the Eagles about 2-3 weeks ago, and I promised I'd wear their jacket about 2 weeks ago and asked for the support in redeploying the Link parking lot as a mass vaccination site for the city. They didn't hesitate to commit. Their organization to that effort, this was before, way before NFL President Roger Goodell committed every NFL stadium parking lot to the country for mass vaccination sites. This was before President Joe Biden, my dear friend and our dear friend, stood with Roger Goodell imploring the city and all the NFL cities to use its resources to speed up the delivery of vaccines. The Eagles have never wavered from their commitment to vaccinate. Yesterday, the Eagles reaffirmed their commitment to vaccinate all Philadelphians at the Link, and in a public statement, they reiterated that comment. So first, I want to thank and foremost Jeffrey Lurie, Dom Slominski, and Dom DeSandro, and their entire Eagle organization for standing with us as we try hard to deliver the most vaccines in the fastest way possible. I also reached out to my friends in labor with large parking lots throughout the city. They all emphatically agreed to that they would be helpful. I reached out to all our hospitals, every single one. They agreed to help the staff as best they could. I reached out to our black clergy for their support. They emphatically agreed to do whatever was needed. I cannot say enough about Dr. Stanford, who is eminently qualified and is doing an excellent service. Frankly, we did not put our best foot forward the last couple of weeks. With the stories coming out about fighting Philly COVID, these stories did not go unnoticed. Why do we have a problem using the Link when New York uses Yankee Stadium, Boston uses Fenway Park, LA uses Dodger Stadium, Miami uses Hard Rock, and many, many more to come? Commissioner Farley says we can't use the Link. I don't want to be critical, but I am what I am. Says we can't use the Link because we will lose vaccines to people coming from Delaware. Well, I can't see Delaware, Dr. Farley. I know you're not from Philadelphia. I mean, I like to see Jersey. I think that might be the issue. But he also said that, and I also told him, I said, there's such a thing that's called an ID. And you have to show an ID when you go get a vaccination, no matter where you're going, Rite Aid or whatever. So he said that may slow up the process, but you still got to show an ID no matter where you go. So we also got, again, Senator Street is in a hearing. He's chairing a hearing on COVID with other doctors throughout the state. And I got Senator Street to agree that he will talk to the National Guard. We will have them help us. They can stand at the gate, and they can check all IDs coming in because you have to show an ID. Councilman Dom, the council members standing with us today, the labor leaders with us, the black clergy, Dr. Ali Stanford, and the Black Doctors Consortium, and all of our health systems, all of them, that we have reached out to support our efforts. They teed up a citywide mass vaccination plan for the mayor and the Department of Health. I'm also confident that the mayor, when he sees the commitment of all these stakeholders to the mass vaccination effort, will join us. And I look forward to working with the mayor and our friends in D.C. to lead the nation and getting shops in people's arms as fast as possible. I did meet with the mayor. I did talk to the mayor a couple of weeks ago. I did present this plan to him. Didn't get anywhere with it. We talked to the mayor. Myself, I talked to him. I called him again last night, invited him here, texted him, invited him in here, and whatever, he's not here. Also, at the line, we can have, at the link, we can have 2 cars. We can have a line for cars that'll line up, and we can have a line for people that'll be undercover. In Lot K, there's a covering. And I saw, as I said to you, started out 2 weeks ago, people in the rain. They won't have to be in the rain. We believe that we can also provide buses. There's a station right here. Now, as you well know, it's a pretty nice little walk, but I think that we got commitments to get shuttle buses from SEPTA to go from there to there. And I also understand that we might be able to get transportation people, from SEPTA that can, that could shuttle us through, and also go out through the all the areas in the city that maybe can drop people off. So, again, I applaud everybody behind us. This is a pandemic. We're not talking about potholes. We're not talking about zoning. We're talking about saving people's lives. As we hear right now, somebody's dying in the city of Philadelphia. As we hear right now, I believe there's maybe like 60, 70 cases that are being diagnosed with this COVID, this terrible disease. So again, all we're trying to do, and I do believe that we are going to get more vaccines. We want to be ready when that happens. We want to be able to say, okay, instead of giving out 30 or 40 at the most vaccines in Rite Aids, we can give out 3,000 or 4,000 here. And guess what? If we don't get that many, why not do it all in one day instead of spread it out for like 4 or 5 or 6 days, when, again, every day somebody's coming down with this horrible disease, and every day somebody's dying. So I just think it's incumbent upon ourselves to try to do the best we can to work together. Again, working together with our council people, thank you all, working together and trying, even with our mayor, and I applaud his efforts for having his plan. That's great. Just to implement a plan that when we can get more vaccines, I have been talking to some people in D.C. I do have a title, by the way. My title is Friend of Joe, and he's my friend. And maybe I could put, when I could say we got a plan like this together, all of us working together, maybe we can try to get much more vaccines. Johnson & Johnson's coming, so we're going to get some more. So again, I applaud everybody, and all we want to do, all these people behind want to do, is save lives. We have jobs to do as elected officials. They have jobs to do, and it's for the betterment and the protection of the city, of the people that we represent. How do we not represent them any better by trying to save their lives? So thank you, and I appreciate Alan, Dom. Thank you, and everybody back here.
Thank you, Congressman Brady. I'd like to introduce our City Council Chair, the Public Health and Human Services Councilwoman Cindy Bass, along with my colleagues on council. And Councilmember Bass has worked tirelessly to stay on top of the city's plans, coordinate with the administration, and call out where they've gone off course. Councilwoman Bass?
Thank you. Well, I want to thank everybody for being here today. Let me first start by thanking Councilman Dom. Let me thank Congressman Brady, all of my colleagues. If my colleagues could come on up, step up. Because we've been working hard on this issue. This is very serious. And as the Congressman just said, this is about action. This is about helping people. This is really about saving lives. We have lives that need to be saved. They need the vaccine, and they need it in short order. So we are really calling upon the mayor to join with us, work together. We don't have to work in silos. We can work together as a team because we're all here to serve the people of the city of Philadelphia. That's what we took an oath to do. That is what we are committed to do. And that is what we should be doing now during a pandemic, now more than ever. So we're calling on the mayor to join this effort and making sure that we have a mass vaccine site here in South Philadelphia at the Link, at Citizens Park, in this area, where we can get people in and get people out and get them vaccinated as quickly as possible. And that is in addition to all of the other efforts that will be happening throughout the city. So it wouldn't just be happening here. It would be happening throughout the entire city of Philadelphia with other efforts for those who can't make it down here. So, you know, there's a lot of work to be done. We need to work together to get it done. And so we call upon the mayor to work with us and make this happen, because this is about saving lives. Thank you.
Good afternoon. I'm here today standing in solidarity with my colleague, Councilmember Dom, and all of the elected officials here gathered today in support of Operation Philly Special. As we continue to grapple with COVID-19, it is vitally important that we create opportunities to ensure the equitable distribution of the vaccine for the residents in the city of Philadelphia. And one way to do that is by creating a mass vaccination site right here in South Philadelphia that will enable us to vaccinate as many Philadelphians as possible in a short amount of time. As my colleague stated, this is about saving lives. This is a moment for us to come together to ensure that we are doing everything we can on behalf of the people we serve. So again, I thank my colleague, Councilmember Dom, Chair of our Public Health and Human Services Committee, Councilmember Bass, and all of us gathered here today in support of Operation Philly Special. Thank you.
Good afternoon. I'd like to echo the words that you've heard from all of the people that are represented here. This is about coming together as a team. We are dealing with a pandemic that we have never seen before. It's the fact that we can come together collectively, as I said in council a few weeks ago, to work on this issue. It's not about this group versus that group, it's working together. I applaud the mayor and his efforts to address the issue regarding teacher vaccinations and reaching out of the chop and bringing that forward. We can continue to build upon the work that the mayor's done by using all of the relationships and resources that we have to come together to address an issue that people in the city are fearful about, which is COVID-19. People have lost lives, they've lost jobs, they've lost businesses by this pandemic. Now, vaccinations are coming into the city. We don't have the supply that we need, but we're getting there. That's why we need to bring all of our resources together to work on this issue. Now, not only as a member of City Council, I serve as president of Democratic Municipal Officials. And just last week, I talked to our past president, Scott Benson, who's a council member in Detroit. And he talked to me about what they're doing at the TCF Center to do mass vaccinations. A former president of Democratic Municipal Officials, Mayor Eric Garcetti, in Los Angeles, and what they're doing in Los Angeles at the Dodger Stadium, mass vaccinations. So we need to use all the resources, all the relationships, the connections, all the effort that we can to bring together the opportunity to protect citizens in the city of Philadelphia. So I applaud all of my partners, all of our colleagues here who are doing this, because it's about working together as a team to end this pandemic for the citizens of the city of Philadelphia. Thank you.
Thank you all for being here. Again, I want to thank Councilmember Dom and all our colleagues, and Congressman Brady, Senator Street, and Mayor Street. This is really an important fact. We know from medical professionals, mass vaccination sites are needed in order to get vaccines out there. It is done all over the country. It is done in other countries. So we know that that is a fact. We know also that the vaccines that are given in other areas is something that is good and we support. We know we have to add these max vaccination sites to the list of Philly vaccination sites so that we can get as many people vaccinated as possible. We don't need excuses. We don't need people saying why we can't do something, whether it's somebody coming from another county or New Jersey, because we know that we have to vaccinate our teachers that maybe live in other counties, our healthcare professionals who live in other counties and other areas. We vaccinated them already. We can come here finding answers and solutions to how to vaccinate people, not making excuses why we can't do it. So together today, we are offering this site and other sites among this, like maybe the Mann Music Center, maybe Leo Core Center, and other places throughout the city, some of our casino venues and the Fillmore and other venues. These things are open to us. Let's look at them. Let's put a plan together so when we do get those vaccinations here, we're able to vaccinate as many people as possible and really get us back to some type of normality. It will not happen until we get people vaccinated. This is just a plan and an opportunity for us to work together so that when we are prepared for when we get those vaccines and we are ready to vaccinate as many people as possible, the people who want to get vaccinated. I know one thing, working with our colleagues, we will not stop. We will continue this effort. We will continue to push to work with the administration and the health commissioner to make sure that we have as many sites available to them so when we do get the vaccines, we can distribute them in an equitable manner. Thank you.
I'd like to thank our chairman of the Health Committee, Councilwoman Cindy Bass. I also want to thank my colleagues, Council members Kathy Gilmore Richardson, Councilmember Derek Green, and Councilmember Mark Squilla for being here and supporting us. And now I'd like to introduce Chris Woods, the president of District 1199C, who represents our hospital and healthcare workers. He took over as leader in the district just over a year ago, and he continues to step up during this pandemic to support our frontline workers. And his support is imperative in advancing this effort. Thank you, Chris.
Good afternoon. I want to thank Councilman Alan Dom and the Chairman Bob Brady for inviting me here and all of the elected officials here today. Being the president of District 1199C, representing all of our major hospitals, all of our long-term care facilities, and child care and home care statewide, this pandemic has destroyed our city, has destroyed a lot of our frontline workers. So I'm asking personally to Mayor Kenney to step up and implement this plan as soon as possible. There are still thousands of folks who need the vaccine. And again, this is not about politics. As everyone said here today, this is about saving folks' lives. And I'm urging the mayor to do that. I know we can do it. We didn't get off to the right start, but we have an opportunity to fix that, and they're doing it in other cities, and we need our city to be one as we get ready to receive a number of vaccines that's going to be coming to our city. Why not have a plan? Why not do it right? Why not do it safe? So Mayor Kenney, please join us in this effort to make sure that we get everybody vaccinated as soon as possible and as safe as possible. And last but not least, I want to thank the Philadelphia Eagles for stepping up and giving us access to their facilities to be able to do this and to do it safe. So thank you guys for being here. Thank you for inviting me. And anything we could do at 1199C to help in this process, you have our full commitment. Thank you.
Thank you, Chris. Thank you. And now I'd like to call up former Mayor John Street, who I consider a friend and an essential ally in this fight to vaccinate all of our people in Philadelphia. And he's going to bring this home for us. Mayor Street.
Bringing it home is probably the wrong home. I want to send us home. I'm grateful for the opportunity to be here. And I have to tell you, I'm tired of wearing a mask. I'm tired of wearing shields. We want to be able to go to our places of worship. We want our children in school. We want to be able to go to recreation centers. We want to be able to go to our restaurants. We want to be able to enjoy the quality of life that makes Philadelphia and the Philadelphia region a very special place. We can't do that unless we do this. We can't do that unless we do this. This is not personal. It isn't personal. It's not political. It's life-saving. It's life-saving. Last year we had 499 homicides in the city. Our children they're running around. They're not based. They're not in school. They're missing the guidance of their counselors. They're missing their friends. They're missing their social network that will help them stay and be in the right place at the right time. They're floundering. They're losing valuable time in getting their education. We can't solve these problems unless we do this. Look, I've been in City Hall. I spent 28 years in City Hall. I've been a council member. I've been a council president. I've been a mayor. I've done all of that. It's hard. It is not easy. It is hard. But no mayor can do this by him or herself. It takes all of these folks. It takes the cooperation from the entire city. This is a family operation. And look, the mayor has had, he has his detractors, he has his supporters, but we have to get past that. We have to get past it. You know, the mayor doesn't talk to certain people. Mayor, you can't not talk to people about this. You can't not talk to people about this. This blood will be on your shoulders. You know, we need to come together. The resources are here. If we're not careful, the vaccines will be available, and we'll be trying to figure out what to do with them. That's not right. The city of Philadelphia needs a plan. This is a plan. Now, I don't want anybody to think it's a perfect plan. There are no perfect plans. It's going to need to be refined. Most of the information about all of this is in the unique possession of the mayor of the city of Philadelphia. So the plan, the broad parameters of the plan can work. And then the mayor needs to immediately create some kind of a task force, some kind of a group, sit down, work with these people, refine this plan, so when those shots become available, we can have the system ready to pump that vaccine in those arms. And we can't wait, because there are new strains being developed. We have to do this now, people. If we don't do it now, it'll be too late. And so I join all of the folks that are here today. I mean, you all deserve an awful lot of credit for deciding that you were going to take matters into your own hands and come up with a plan. Nobody wanted to do this. Nobody wanted to say. I know Councilman Dom. He's about as collaborative a person as I've ever seen. He didn't want to be out here without the mayor. I've known Congressman Brady for 40 years. He carried me out of city council. Literally. These are people, these council members, they don't want to do this for them. They want to do this for us, and they want to do this for our city. And so in the true spirit of cooperation, in the true spirit of concern for the great people of the city of Philadelphia, we're asking the mayor, we're begging the mayor, work with us. You're the leader. Anybody who thinks anybody else is the leader in this city is mistaken. None of this can happen without the mayor. I don't care about all these meetings. We can have all the plans. We can have charts, graphs. We can have websites. Without the mayor, it can't happen. It won't work. So all we're saying is, whatever issues people have about anything that ever happened or anything you think might happen, let's just take this special moment and come together for the people of our city and get ready so that when the vaccine comes, we will be prepared. Thank you, and God bless you.
Thank you, Mayor. Thank you. Thank you, Mayor Street. Thank you very much. It's great. So just some final comments. I want to thank Jeffrey Lurie, Don Smolensky, and the entire Philadelphia Eagles organization and the NFL for stepping up not just today, but every day to set the example for what corporate leadership should look like in our city. I want to thank our President Joe Biden, who I know is working hard to boost the number of vaccines. And I want to thank him for supportive comments on Sunday for the use of stadium vaccination sites. I want to thank also Councilmember Kenyatta Johnson, whose support of this effort was unfortunately unable to attend today. I want to thank the health systems we've spoken to who are waiting to help. Everyone said, yes, we'll help. Penn, Temple, Drexel, Jefferson, Einstein, and Wills Eye. Everyone has personnel, resources, and volunteers standing by to assist. Congressman Brady and I have been in contact with several of our religious leaders who have also agreed to offer their space or be helpful in any way they can. I want to thank them also. Senior Pastor Glenn Spaulding from Deliverance Evangelical Church, Reverend Dr. Alan Waller from Enon Tabernacle, and Reverend Dr. Herb Lusk from Greater Exodus Baptist Church. I want to thank all the unions, labor unions who stepped up and offered sites. Gary Massimo from the Sheet Metal Workers, Georgia Pogrom from the Plumbers, FOP President, John McNesby, and basically also we have the Mann Center for Performing Arts, who've recently offered to also host a mass vaccination site in West Philadelphia. I think that was coordinated by one of my colleagues. Councilmember Kathy Gilmore Richardson, thank you, and I want to thank them for stepping up as well. I want to say a special thank you again to Congressman Bob Brady. He spent an enormous amount of time on the phones to get here today. Lastly, I want to thank all of you for coming out in this winter, cold weather, standing here with us, but listening to this plan, because we do think it is the right decision for the city. At the end of the day, everyone here and everyone we've spoken to, everyone wants to help build a final, detailed plan to vaccinate the largest number of residents we can. We want the city to succeed. We want Mayor Kenny and the Health Commissioner to succeed. So let this be the call to action, to finally bring everyone to the table, to put these ideas to paper in a transparent manner. Let's do it well before we see increases in our vaccination allotment. We're happy to take any questions.
Can hear it.
That is a kind of an insulting comment to make, but I will say this. Our goal is to have Dr. Stanford from the Black Doctors Coalition organize this. And if anyone has worked with Dr. Stanford, you will know that she's probably doing one of the best jobs in the city to make sure there's access and equity for everyone. We want this to be available for everyone in the city. We want it to be fair and have access and equity. And so, we can't hear you too well, sorry.
Identification.
There's two ways we can handle it. One is we can have registration and identification through driver's licenses. People doing the vaccinations can enforce it.
We have help from the National
And we have help
Guard.
from the National Guard too. We can enforce that, and also we can also do invites based by zip code, and we can control it that way. We could take zip codes of the city, and Dr. Stanford will coordinate this and invite people based on the zip codes of the city, so we can control who's getting vaccinated. But those comments are no's. Let's find out how we do it together. We're willing to work with them. This is a good idea. Almost every other city is doing it. And they said to me initially, well, only 82% of the people have cars, and 18% do not. Well, SEPTA's on board to help us with vaccine express trains and buses. They'll get people here. And if 82% of the population can get here, that's pretty good. And then they said to me, well, it's not going to work. It's too cold out. Well, Boston, it's working in phenomenally, and New York, it's working in phenomenally, and I think it's a little colder there. So instead of putting up these roadblocks, we want to work together. I heard not all of it, but I think your question is there a communication breakdown?
Between you and the mayor, because everybody up here is saying the mayor doesn't want to talk to us, the mayor isn't interested in us. Have you been in touch?
I'll let Derek answer that.
Yeah, if you heard what everyone was saying, is that we want to support the mayor, what the mayor's done, but is in addition to. This is not us versus them. This is about all of us coming together collectively. And so this is one step of trying to continue that conversation and augment what the administration is doing. And I feel the fact we're having this conversation that we're going to continue to move forward. As I said in council a few weeks ago, we can ask hard questions about what happened with Philly fighting COVID, but at the same time, we can work together to move forward. This is something that we've never seen before in this city. And so we've got to work collectively together. It's not about how I feel or how this person feels. It's about how we work together to save lives in the city of Philadelphia from all perspectives.
Part of the issue, James, is really fighting COVID, and I'm sorry, I just don't want to take off my mask. Part of the issue with really fighting COVID, it seems, is that they were non-profit entities and then became a for-profit entity and did not meet the city of law. Is there any for-profit component related to this plan?
We have no for-profit component related to this plan.
And then I don't know if Congressman Brady can speak to this. You certainly served in Congress at the same time. You've been our president with a senator. Do you have any thoughts on or any direct lines to him in terms of whether we
I heard bits and pieces. I'm sorry.
I'm sorry.
I didn't hear the whole thing.
Just your relationship with now President Biden. Do you have any sense of whether we may prioritize getting vaccines
I-
to Philadelphia?
I just feel that working together with everybody, getting this plan in position, by doing what he's asking us to do, by using stadiums, by doing what he's asking us to do, that I would be a much better ground to go to him and say, guess what? We're ready. We have the stadium here. Not only this stadium, we have parking lots throughout the clergy, throughout our labor unions that are ready to set it up. They're all ready to set the spaces up. They can walk in, they can drive in. As I said, Lot K is under roof. When I saw this 2 weeks ago, and the people in the rain with umbrellas and freezing, we have a roof over here. So the Eagles offered right away, and so did our other organizations. So did Deliverance. So did the other churches, the African American churches. They offered their spaces and they offered their spots. And I just thought that if we get this together, and the mayor says, okay, fine, we're getting ready to do this. If we get more vaccines, we'll be ready. And I can go and then I can articulate that argument a lot better.
Can you reach President Biden?
Can I reach President Biden? Absolutely. I talk to President Biden all the time. He's my friend. I told you I got a title. My title is Friend of Joe. Good. Which channel tell me knock them down?
It's my understanding that the city and county of Philadelphia is the only city and county in the Commonwealth of Pennsylvania that has the responsibility to create and implement its own plan. All the rest of the counties are under the supervision of the Commonwealth of Pennsylvania. We are different. We are bigger. We're larger. We're more diverse. We're poor. And the governor is saying to the city, you figure it out. The governor should be credited for that. What the governor did was said to the mayor, you know this city and better than anybody else. This is not a presidential issue. This is a local issue that we are responsible as a result of the governor of the Commonwealth of Pennsylvania giving us the responsibility to do it. And we have to do that. And it can't be done without the mayor. The vaccines are coming, but they're coming to the city of Philadelphia, and we have to have a viable plan. Now look, I didn't write the plan. I'm busy trying to stay alive like everybody else. It is unacceptable for the mayor to meet with the councilman, to meet with the chairman, to hear everything to know everything that's in this plan, and ask a question, release something that is a red herring to what we're trying to do. This plan takes into account the diversity in this city. It takes into account poverty. It takes into account all of those situations. They have gone out of their way to make sure they talk to representatives of those communities, and it is disingenuous for the mayor to try to torpedo this plan by raising that issue. And he didn't, and he put out something that's even worse. And it's proof positive the reason why we have to have this meeting. Nobody wanted to do this. Do you think these people want to come down here and stand and have a press conference? What they want to do is go to work. And they can't go to work. And the mayor knows that. He knows this can't happen without him. And I don't know why he can't put his own personal feelings aside just this once, Mr. Mayor. Just this once. Find a way to be collaborative with the city of Philadelphia, with the council, with the labor, with the hospitals, I mean, Congressman Brady has done a wonderful job, and all of these council. Why is it that he can't find a way, you know, just to sit down and refine this plan? That's what has to happen. These folks have the outline of a plan that can work, but they can't, I said this earlier, it cannot work outside of cooperation with the chief executive of the city of Philadelphia, and that's the mayor.
Mayor, Congressman, why do you all have, it seems like you're having to drag this chief executive along. You're all veteran politicians. What's the unspoken here? What's the political reason you're having to take the mayor of the city by the hands and drag him along when the football stadium and the team are ready to go? All of the medical partners are ready to go, as Councilman Dom said. It seems like everybody's ready to go. But the mayor, what's not being said here? Why is he not on board?
Everything is being said here. He's not on board because he doesn't want to be on board. It seems to me, well, you know, why don't you ask him why isn't he on board? We want him to be on board. Look, I spent 20 years in city council. I know the extent to which council members can implement a plan like this, and that they can't.
Well, is it that he just doesn't want to? I suspect there's a very political reason.
Well, I don't know why. I don't know why. People have said, you know, we want you to work with us, Mr. Mayor. Please, Mr. Mayor, we're begging you. People are dying. I don't know what else he needs. Nope. What else does he need?
That doesn't make any sense, Mayor.
Well, it doesn't make any sense, and that's the reason why I'm here, because it doesn't make any sense. It makes absolutely no sense. And I will tell you, if he doesn't get on board with this plan, he's going to find people hanging around City Hall, hanging out in front of his office, dogging him about why he isn't supporting this plan. And if he doesn't want to support this plan, he better have one in 48 hours. He better have his own plan. He better figure out how he's going to take all of these shots that are coming from Johnson & Johnson, from Johnson & Johnson. How's he going to do that? He doesn't know how to do it. He couldn't figure it out when we were getting just a pittance of things. I don't even know how he figured out how he was going to use a 20-year-old from Drexel to administer this program. It is beyond comprehension, which is the reason why we are here. Otherwise, I would be home making stew. Jesus, I mean, what is wrong with him? I'm sorry.
What's the reaction to the city's statement? It was mentioned that this group is deliberately trying to ensure white privileged suburban residents and other
you know what I think? I think it is a red herring, and I think he's using it as a way of distracting from his own inadequacies, his own incompetence, and his own lack of any appreciation for the magnitude of the problem. And he figures if he raises that question, now all of a sudden we can be talking about that issue instead of talking about what we really need to be talking about. And I resent that. I resent the fact that he's throwing race into an issue when it's not just race, it's poverty, it's a lot. And all these statements from all of these wonderful people who care about the city have addressed it. But he knows, he's smart enough to know, if I raise that question, boom, I can get some attention. And I really don't like it. I really don't like it. Because what it is doing, it's deflection. It's deflection. And his handling of this to this date has been incompetent.
Has there been any if this, if that, then I'll go along with your plan? Does he have any caveats?
Let me just say this. Congressman Brady reached out to him last night. I texted the mayor last night asking him, Congressman Brady reached out to him last night. I texted the mayor last night asking him to actually join us. We want him here. We want to work with him. This is not politics. This is about saving lives. And we want Dr. Stanford to run this because of everyone we've seen, she's doing the best job possible. So anyway, I want to thank everybody for being here.
What was the mayor's response?
He didn't respond. I want to thank you all for being here. Really appreciate it.
I gave his 2
and
weeks ago.
hopefully the mayor will respond, and more importantly, hopefully we'll have a plan So when these 40 or 50,000 vaccinations come into the city, we'll know how to implement it, because that's really our goal. Thank you very much. Thank you.
Thanks, Alan.
Hey, Congressman.
Oh, you're good? Yeah. Excuse me?